quick diagnostic approach for anemia classification that makes it so as easy as ABC. So, first we need to categorize it into 3 slides: microcytic, normocytic, and macrocytic. Microcytic means the MCV is less than 80, and I want you to remember the mnemonic tails. T is for thalassemia. Think target cells, and normal iron studies, and normal red cell distribution width. Next, A, that's for anemia of chronic disease. Remember that inflammation, autoimmune diseases, that's going to increase hepcidin, so your iron gets trapped in the cells. Deceased iron causes anemia, so you're actually going to see a high ferritin and low TIBC. The I is for iron deficiency anemia, so your iron stores are actually low, so you see low ferritin and a high TIBC. L is for lead poisoning. The keyword is basophilic stippling, and then also look out for abdominal and neuro symptoms. Finally, S is for sideroblastic anemia. Basically, the iron gets stuck in the mitochondria, and you see these ringed sideroblasts. Now, if you have a normocytic anemia, the next step is to look at the reticulocyte count. If you have a low reticulocyte, that means the marrow is not producing enough red blood cells, so you're thinking CKD, aplastic anemia, or bone marrow infiltration. Whereas, a high reticulocyte means the bone marrow is responding, so you're thinking more states of blood loss or hemolysis. Remember, your key labs for hemolysis are going to be a high LDH and high indirect bilirubin. And finally, we have a macrocytic anemia. That's an MCV of anything over 100. And I want you to divide it into megaloblastic and non-megaloblastic. For megaloblastic, that is a DNA synthesis problem. The 2 key players are B12 and folate. Remember, B12 is going to cause neurosymptoms because you have a high methylmalonic acid and homocysteine. Whereas, in folate deficiency, you're not going to see neurosymptoms because methylmalonic acid is normal. And the final branch is non-megaloblastic, and that's typically due to alcohol or liver disease or hypothyroidism. Like and follow for the next lesson.